You with Body Radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We have a caller. Good evening, madame. You're on the line.
Thank you. My name's Kathy Morelli. I'd like to get a book from Dr. Lederman.
And you what?
I'd like to get the book from Dr. Lederman.
Okay, well, that's great. You're on the radio, and we have 50,000 people listening, so I suspect you don't want everyone to have your address. So just call us during the work week, Monday through Friday, 9 to 5. Same phone number, and we will send it out at no charge to you.
I want to thank you, sir.
All right. Thank you, and God bless you. Bye now. Bye-bye. Thank you. Okay, so again, if you want the booklet, call us during the work week, Monday through Friday, 9 to 5. We will pop it in the mail. There's a booklet about brain tumors, about body cancers, and about prostate, and a DVD, which we're happy to send at no charge. I want to talk about a woman who came really dire straits. 81-year-old woman. She had a thyroid cancer. Her gynecologist detected the thyroid mass. So it's a pretty good gynecologist to find this mass in her neck. She was diagnosed in September 2012. At that time, she had surgery in Long Island. The cancer was up against the trachea. The surgeon said he scraped it off the trachea, which is very unusual. She then had radioactive iodine. She went to then the big cancer hospital. She had standard radiation. And within a short period of time, the cancer grew. It's a papillary thyroid cancer. The cancer grew through the trachea. So they had to put a trach in, which is an opening from the outside in the neck to the trachea. And then it grew into the esophagus. Remember, the food tube and the air pipe, the trachea and the esophagus, are just adjacent to each other. And this cancer grew through both. I think we have a caller. Let me just get this caller. Excuse me 1 minute. You're on the radio. Good evening.
Hello.
Hello. Good evening. You're on the radio.
Yes. I have a friend. She's 50 years old, and she has ovarian cancer.
Mm-hmm.
And it has. I'm not sure exactly where, but it's in the pelvis area somewhere. She had a hysterectomy some time ago. She's had 6 years in the past of chemotherapy. Then she went on alternative therapy. Now back once a month chemotherapy, but it's invaded the left ureter as far as pushing against it and blocking it, and then she had a stent put in, and which relieved the pressure on the kidney. And I think it involves the spleen also, and she has some other tumors, one near her lungs, and some others.
All right, well, the best thing really for her to do is to come in so we can examine her and get a history and find out where the cancer is. Obviously, a stent doesn't treat the cancer. It just opens up a blockage, but the cancer is still growing. So the beauty of radiosurgery is that we often can treat blockages. We do treat select ovarian cancers. We have to see exactly where the patient's cancer is, and that's best done when she comes in and we analyze all the records and her, and if necessary get tests to look at where exactly the cancer is.
Yeah, she has also a blockage in her bowels, taking from this also.
All right, we'll just have her call us. Call us at 212 Choices, and we'd be happy to help her, invite her in, see her, and give her other advice and hopefully other choices, okay?
Okay, right now she's in a rehab. She has type 1 diabetes.
Yeah, well, we could deal with all that. So just have her come in.
And she had recently had an episode of hyperglycemia.
All right.
A bit of hypoglycemia.
All right, I got you. I'm sorry we've got to go. Just have her call me, make an appointment, and we will go over all the records, all the details, and do what we can to help this lady, okay?
Okay, thank you very much.
Thank you, and God bless you. Bye now. Thank you. So we often get calls like that of people in trouble, and we can often help. Can't help all the time, but we often help. Anyway, this woman has a cancer growing from her thyroid through the trachea into the esophagus. We staged her up. She hadn't been staged up. She's losing weight. Her legs are swollen. We're checking her for blood clots. We staged her up immediately the same day. Everything, the blood clots, the PET scan, and we found that the cancer had increased by 8-fold in the last few months. The good news is the cancer hasn't traveled anywhere, but it is very extensive, growing through the trachea and esophagus. We spoke to her about a variety of options for her, including focused beam radiation, and radiation does work for thyroid cancer. We know that from a long history of different kinds of radiation, including radioactive iodine and the like. So there are choices and chances for her, and I'll keep you informed as to what her decision is and hopefully how her treatment works, hopefully successfully for her. We also had a man who came in with a lung cancer who lost 50 pounds and got double vision on chemotherapy. Wow. 73 years old, electrical engineer. He had an abnormal chest x-ray in January. He had double vision. Now, when cancer's involved, often cancer will spread to the nerves that control the eyes and interfere with the movement of the eyes. So it's very suspicious. Unfortunately, he never got the best test, which would be a contrast MRI of his head to find where the cancer traveled, to pick off that nerve so we could treat it. So he got new glasses with prisms, but no one's taking care of his cancer. He's been on chemotherapy, doing poorly. He's lost 50 pounds. Wow. So he's gone from 170 to 120. He's got this double vision. He's got disease in the right middle lobe and in the right hip. So we invited him in. I saw him at length. We discussed all the options for him, including getting him staged, which is so critical. A person has to be staged, know where the cancer is, before we can actually hit the cancer to try to make him better. And this week, we saw a new patient with a prostate cancer. PSA went from 6 just a month or two ago when he was seen by his urologist to PSA 7.79, so the cancer is active. He has a Gleason 6. The Gleason is how the cancer looks under the microscope. The PSA is the protein that's in the blood that's measured by the blood test. He was positive in 3 of 7 cores. He wanted the best possible treatment, and our treatment with brachytherapy and treatment in a stereotactic frame for a PSA 7, Gleason 6, is about 95% cancer-free survival. So you can look at our book and see how that compares, which is very favorable. So this man wants to keep his sex life, his urinary life. He wants the best chance to be cancer-free, and I believe he will have that with us. And we had a man with a head and neck cancer. So we talked earlier tonight about a man with massive head and neck cancer. So this is a man we treated 2 years ago, came from Iran with a head and neck cancer. He was treated for a tonsillar cancer with focused beam radiation. He had a PET scan this week. Perfect. No cancer. It's the good news department. He is very happy. We're happy, and hopefully he'll stay like that for the rest of his life. He should live to be 120. It's just about the end of the hour. This is Dr. Lederman from Radiosurgery New York.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the